Now we'll take a turn and talk about the effort to find a drug that would boost a woman's sexual desire. They may be nearly here.
Don't let erectile dysfunction get in the way.
For 15 years, the little blue pill has offered men help in the bedroom, but what about women? Studies show that between 1 and 4 years into a relationship, a woman's sexual interest begins to dive. And up to 15% of women between the ages of 20 and 60 years old suffer from what's known as hypoactive sexual desire disorder, defined as a lack of lust that creates emotional stress. In an excerpt from a new book, What Do Women Want? Adventures in the Science of Female Desire, the New York Times Magazine highlights a new set of drugs that aim to increase sexual desire in women. Let's turn to sex and relationship experts Ian Kerner and Logan Lefkoff. They'll shed some light on this topic. Good morning to both of you.
Good morning.
Okay, I should mention actually that these two new drugs we just mentioned, Lybrido and Lybridos, were created by a company called Emotional Brain. They're still in the trial period. Could be years away before we had FDA approval. So let's get that out of the way. First of all, let's just address the problem that this aims to correct, which is that women in monogamous relationships have some sort of inordinate drop-off in sexual desire. Do you find that being on the front lines of this?
Yeah, well, I would say that for couples as a whole, men and women, sexual desire does tend to wane as you go through a relationship. We did a survey of about 5,000 men and women on the topic of sexual boredom and relationship boredom, and 50% were bored in their relationship.
But we seem not to be surprised by that when it's men. You know, this opens up a whole new can of worms when women are saying, I'm bored, I want novelty, I want diversity, and it calls into question this concept of monogamy. We might choose it, but is it natural? Jury's still out.
Well, and boredom is not a medical condition. You don't necessarily take a pill to make your relationship less boring.
Well, that leads me to my next question, because let's say a woman does have a drop-off in sexual desire that she finds to be so problematic she wants to address it with a pharmaceutical. Can you even do that? I mean, isn't female sexuality kind of complicated?
Hugely complicated, and we are a pill-popping society, but women have been socialized and browbeaten for years. You know, turn off your sexuality, don't be sexual, you're not equal to men in these areas. So all of that guilt and shame plays a role in our libido.
What are the implications of trying to fix this with a drug as opposed to addressing deeper relationship issues?
I think it's like a lot of things with drugs. You're treating a symptom and not the cause. For me, your sexual well-being is connected to your overall well-being. So if you don't feel desire in the bedroom, there could be something wrong with diet, exercise, stress levels, your health, your
partner,
relationship.
Your relationship.
Well, get right to it, Logan.
Last but not least, your relationship. But I will say that, you know, particularly like for the millions of men and women who are on antidepressants and who have artificially high serotonin levels and are dealing with the sexual side effects of medications, perhaps having a pill to balance and lower serotonin temporarily, which is what this pill postulates to do.
I want to address one thing. I mean, and be careful, sex therapists. Let's not get too graphic here, but some people call this Viagra for women. That's a little bit of a misnomer.
Definitely not true. I mean, Viagra works by increasing blood flow to the genitals. Female sexuality is very different. The lens through which we like to talk about sex is always biologically male, but it doesn't take into account the complexities of women's sexuality.
And what's interesting about these drugs that are being tested is it seeks to address desire, something that's more psychological.
Definitely.
Exactly. And the other thing to remember, even with Viagra, is that it doesn't address desire in men either. And that there are millions of Americans, in fact, in all of my work with couples, it is just as likely for a guy to be experiencing low desire as for his female partner.
All right. Ian and Logan, thank you so much. We appreciate it.